Part 5 of Module 6, the nervous system. The nervous system is a complex system. It controls and coordinates all body functions. It sends messages throughout the body and senses and interprets information from outside the body. Neurologic means pertaining to the nervous system. Divided into two main parts, the central nervous system, CNS, and the peripheral nervous system, PNS. The central consists of the brain and spinal cord. The peripheral consists of cranial and spinal nerves. Functions include speech, motor, and sensory activity, coordination, intelligence, memories, emotion, breathing, and heart rate. Nerves carry messages to and from the brain from the rest of the body. Sense organs are the skin, nose, eyes, ears, and tongue, all part of the nervous system. Normal changes of aging that relate to the nervous system include responses and reflexes slow, some memory loss, especially short-term memory, sensitivity of nerve endings in skin decreases, resulting in diminished sense of touch, some hearing loss, and weakening of the senses. Age-related vision changes. Vision changes are also part of the nervous system, as the eye is a sense organ for seeing. Nearsightedness and farsightedness may be familiar to you. Glasses or contacts can help improve vision for reading or distance. A cataract may be hereditary. It develops when the lens of the eye becomes cloudy and blurry. Light is prevented from entering the eye, and vision is compromised. A cataract can eventually cause blindness in one or both eyes. Surgery is usually performed to remove the lens that has turned cloudy, and an artificial lens is implanted. Glaucoma is when eye pressure increases and can damage the optic nerve that is necessary for vision. Symptoms include pain, nausea, vomiting, seeing a halo around lights, reddening of the eye, and blurred vision. If not treated, glaucoma can cause blindness very quickly. Treatment includes eye drops and other medication or surgery. Macular degeneration is a condition in which the part of the eye, the macula, located in the retina of the eye, that allows people to see detail, wears out. Age-related macular degeneration is the most common cause of vision loss in the elderly. There is no pain associated with this disorder. Vision problems can vary in each eye. Complications of the nervous system, excluding the age-related vision changes, include CVA, which is a cerebrovascular accident, also known as stroke. CVAs occur when blood supply to a part of the brain is blocked, or a blood vessel leaks or ruptures within the brain. There are several types of strokes. A TIA is a small stroke. You may call that a silent stroke. It is a warning sign. Signs and symptoms are listed in Chapter 8. Recall the word hemiparesis, hemiplegia, aphasia, and dysphagia from the vocabulary. These problems can result from brain damage after a CVA. Personality changes, loss of thinking and learning disabilities may also occur. Next is Parkinson's disease. This is a progressive disorder that causes a part of the brain to degenerate. Neurons in the brain that produce dopamine begin to break down and die. Tremors, shaking, rigid muscles, shuffling feet, and speech are affected. The brain can experience other changes in personality, behavior, and loss of mental abilities, also known as dementia. Treatment includes medication and supportive interventions. Next is multiple sclerosis, abbreviated MS. This is a progressive nervous system disorder. It affects the way impulses are transmitted to and from the brain. When a person has MS, there is loss of myelin in the brain. That is the protective covering that covers the nerves and the spinal cord. Without that covering, nerves cannot send clear messages to and from the brain in a normal way. MS is unpredictable and can cause a range of problems. Head or spinal cord injuries are generally complications from trauma or accidents. A head injury that occurs from a banging movement of the brain against the cranium, the skull, is called a concussion. Head injuries can be subtle, or symptoms can be obvious, such as confusion or disorientation, along with serious complications. When a person sustains a spinal cord injury, it means that the spinal cord is cut or damaged in some way. Severe injuries can end in loss of function of the arms, the trunk, and legs, which is all together called quadriplegia. Next, seizures. These are also known as convulsions. This is involuntary muscular contractions. The cause originates with an effect somewhere in the brain, perhaps a tumor, an injury from a medication, having a high fever, a stroke, dementia, alcohol, or other drugs. Meniere's disease is a disorder of the inner ear caused by a buildup of fluid in the ear. Hearing loss, dizziness, also known as vertigo, and ear affection can occur with Meniere's disease. Nervous system complications can affect the brain's orientation. Orientation is awareness of time, place, and person. The opposite, not being aware, is called disorientation. When a resident is disoriented, they may be delusional, have false beliefs, or they may be lost. Caring for residents that are confused can be challenged. Confusion is a state, not a diagnosis. However, confusion may be part of several mental disorders. Delirium is a rapid onset of symptoms, lasting from hours to days. It is also known as acute confusion. Symptoms vary, including reduced focus, attention, changes in memory, use of language, sleep disturbances, restlessness, delusions, or hallucinations. Hallucinations are false sensory experiences, like if you see things. The benefit of delirium is that it is reversible if the cause is identified and treated. Delirium can be caused by many things, like a severe infection, lack of oxygen, side effects from medication, pain, fluid imbalance, and diabetes complications. People with dementia are more at risk for developing delirium, but delirium and dementia are two different things. When a resident has dementia and delirium together, they need even more help than normal with activities of daily living. Dementia is the chronic loss of mental abilities. It has a slow onset that progresses in severity. Characteristics of dementia are similar to delirium, but they are not reversible. Cognition, which is thinking, remembering, reasoning, and communicating, is very affected. It interferes with normal functions and ADLs. There are many causes of dementia, but the cure has not been found. Medications are available to help slow the disease. Alzheimer's is the most common form of dementia. Vascular dementia is the second most common. That occurs from injuries to blood vessels that supply blood to the brain, as in a head injury or stroke. The symptoms are similar to Alzheimer's: memory loss, disorientation, and difficulty communicating. Depression is another complication involving the nervous system. Signs of depression include apathy, sleep problems, irritability, and trouble performing normal tasks. Always report signs that you observe to the nurse. Depression is an illness and should be taken serious and treated. Other mental illnesses that people may have could be generalized anxiety, post-traumatic stress, obsessive-compulsive disorder, which is OCD, bipolar, paranoia, and schizophrenia. Maintaining and promoting mental health is important for all of us. A mentally healthy person will be able to use cognition and emotion appropriately and have relationships with other people. They can deal with difficulties, impulses, and responsibilities successfully. Interacting well with others is a trait of mental health. Acknowledging and supporting mental health is just as important as recognizing and taking care of those that have a mental illness. Some loss of cognitive ability is normal. However, dementia is not a normal part of aging. This chapter has great information on how to identify with people experiencing dementia and how to care for them. More training is available in facilities that employ staff who work with the residents that have dementia. Alzheimer's disease. Alzheimer's is an irreversible disease. Every victim progresses differently, showing different symptoms at different times. There are 7 stages, although there is no clear-cut moment when a victim will move from a stage. Research is being done to definitively diagnose AD, which is Alzheimer's disease, by a blood test. Here are the 7 stages of Alzheimer's disease. I'd like you to review these. The first stage is no impairment, and then it gets progressively worse. By the end stages, we see a very severe decline. These people may not be able to communicate anymore, control their movements, or respond to surroundings. Muscles are very tight. Their reflexes are abnormal. They can't control their movement, when to sit, walk, stand. They can't understand anything being told to them at this time. They may not even have that reflex to swallow, smile, or take a breath. Behavioral symptoms in Alzheimer's disease. Behaviors we see can be depression, sundowning, pacing or wandering, repetitive phrasing, which is called perseveration. If you hear someone repeat the same thing after just a few minutes go by, they may have Alzheimer's and have perseveration. Disruptiveness or social inappropriateness, catastrophic reactions and violent behavior, hallucinating, delusions, or paranoia, pillaging, rummaging, hoarding, and then also inappropriate sexual behavior. We have to have compassion for these people because they truly don't know what they don't know anymore. Considerations in Alzheimer's disease. Always identify yourself and greet resident by name. Speak slowly and quietly, using a calm voice and approach. Reduce background noises. Added stimulation can make them more irritated. Use pictures, touch, and gestures if that is helpful. Talk about one subject at a time. Keep messages simple. Repeat directions and answers as many times as needed. Limit saying the word don't and no. Be aware of your body language. Do not take inappropriate responses or accusations personally. Move on to the subject that is more appropriate. Interventions we can plan. We'll change the timing of ADLs, visits, and activities for the time of day when residents are feeling their best. Activities can help maintain or improve function in daily life. Promote quiet rest between activities and low stimuli environments. Be encouraging and patient during all cares. Praise often. Remember that behaviors are not within the resident's control. We must be willing to adapt to each situation. Remember to always treat adults like adults. No matter what your opinion is, adults deserve to be treated with respect, dignity, and worth. Report these observations to the nurse. Changes in behaviors and moods, increased confusion or forgetfulness, changes in needs for assistance. The care plan may need to be updated. Changes in appetite, sleep, or pain, thoughts of suicide, signs of substance abuse. This summarizes the information for the chapter on the nervous system. Please review the reading content and questions. Thank you.